The 1918 Spanish flu outbreak. In the spring of 1918, a deadly outbreak began to spread across the globe. It started quietly, almost unnoticed, in the midst of World War I. At a military base in Kansas, soldiers began to show strange, flu-like symptoms. What seemed like a routine illness would soon turn into one of the deadliest pandemics in human history. Within months, the virus had crossed continents. It reached Europe, Asia, Africa, and beyond, infecting millions of people. It struck swiftly, with fever, fatigue, and intense body aches. In some cases, the flu would turn fatal in just days. Hospitals overflowed with patients, many unable to receive the care they desperately needed. What made this outbreak so deadly was its unpredictable nature. While most flu strains are most dangerous to the very young, the elderly, or those already weakened by disease, the Spanish flu took the lives of healthy young adults. Doctors and medical experts were baffled, struggling to understand how the virus spread so quickly and caused such devastation. By the fall of 1918, the pandemic had reached its peak. The world was caught in its grip. Streets became eerily empty as entire cities went into lockdown. Public gatherings were banned, and people were advised to wear masks to protect themselves. Still, the death toll rose, claiming an estimated 50 million lives worldwide. Unlike the flu strains we know today, the Spanish flu came with a brutal force. It wasn't just the severity of the illness that shocked the world, but the speed and the scale of its spread. No one was safe, and the world was left reeling in its wake. By the time the pandemic subsided in 1919, life had been forever altered. Communities mourned their lost loved ones, and the world had learned a painful lesson in the fragility of life. The Spanish flu would be remembered not just for the lives it took, but for the way it forever changed how we approach public health and pandemics. If you found this story meaningful, help the channel grow by liking, sharing, and subscribing.